Hello everyone, welcome to my channel. In this video I'm going to talk about bronchitis. Okay, first we'll know what is bronchitis and what are the causes of bronchitis, what are the symptoms of bronchitis, and what are the homeopathic remedies which are really helpful in the treatment of bronchitis. Myself, Dr. Megha from Homoeopathic Clinic. I am a practitioner of homeopathy from 5 years. In this channel, I am trying to convey so much of homeopathic medicine which are really helpful in the treatment of diseases without any harm or without any side effects. Moving on to what is bronchitis. Bronchitis is an inflammation or infection of the mucous membrane of the bronchial tubes. Because of that, there are so much of symptoms which it produces. The first one is cough, second one is mucus production. It may be yellowish, greenish or whitish. It depends on the patient, and it also depends on the severity, and it also depends on the cause why the patient is been suffering with the bronchitis. Another one is weakness, fatigue or difficulty in breathing, congestion of chest, everything. Shortness of breath and cannot sleep straight, always want to lie down in a upright position like this. Okay, now we'll be knowing about what are the homeopathic remedies which are really helpful in the treatment of bronchitis. First one I'll be talking about is Kalim bike. Acute or chronic bronchitis. Bronchitis has two types. Sorry to mention, it has acute bronchitis and chronic bronchitis. Chronic bronchitis is because of so many causes, and it's a long-standing one. Acute one is because of fever, or because of change of water, or because of some cold eating, like that. Calibric is given in acute or chronic bronchitis. Mucus is always tough, stingy. It is always difficult to raise. Natrum urs. We also give natrum urs as arsenic alb is also given in the bronchitis. Natrum urs is given in the bronchitis of children after 7 years of age and before puberty. Phosphorus cough on speaking and laughing, which is worst at night. Cough when comes in is strong and it hurts the body. The patient tries to suppress it as long as possible to avoid the hurting, but still the patient always tries to cough. The phosphorus patient, how you can really kind of differentiate means the patient will be unable to narrate his symptoms. Always he will be saying, Doctor, I'm having a cough and it's so kind of hurting my body whenever I cough. He starts coughing. Then he jumps to other thing. There is no completion because the cough always kinds of interacts in between speaking and laughing. And phosphorus also says that it is always kind of more during the night time. He will be saying when he was having the food he was better, everything was better. When he went and lied on the bed and he put his head on the pillow, the cough started. Like that he says. Okay, next one is pulsatilla nigra. Pulsatilla nigra is given in acute and chronic bronchitis, both kind of bronchitis, and it is a primary medicine for the cough treatment. Cough first on lying down. This is also same as light thought of phosphorus, but for phosphorus lying down during night, but here lying down, it may be day or any time, but lying down it makes the cough worse, compels the patient to always sit up. Next one is restox, bronchial cough in the old age people followed by eruptions of eczema, psoriasis, like that, or it may also follow by gas formation, constipation, or indigestion, like that. Any kind of thing will be accompanied in the old age people. Expectoration of small plugs of mucus, which is has so much of differentiation with the colors, there is no need to consider about it. Next one is veretum alb. Chronic bronchitis in the aged, loud barking stomach, cough followed by eruptions, and it is also worst in the warm room or on entering a warm room from cold air. Rattling of mucus in the chest, but it cannot be coughed out. This is one of the peculiarity of the veretum alb. I had not given veretum alb for bronchitis, but if you want to try, you can try it out. Carbo-veg bronchitis of old people. Carbo-veg when I preferably give is, of course, it is given in the old age of bronchitis, but I preferably see that if they are having any kind of acidity, gastric ulcer, or indigestion or aversion to food. Aversion to food is they does not want to eat the food. Whenever they see the food, they feel like I cannot eat, like that. Whenever the patient says like that, I think of carbo-veg. With bronchitis, with stomach problems or GIT problems, I give the carbo-veg. In what potency? 30 to 100, anything is safe. Ferrum-First, bronchitis of young children who are pale and weak. Young children means very young children, school-going children. It may be first standard, second standard, like that. Or the girls, especially the girls who are anemic, who are having the HB level which is 6-7, like that. You can think of phosphorus. You can also give in 6x potency with constitutional remedy, or you can also go with potentized 36 to 100, like that, without 6x also. Ipecac bronchitis of infants. Wheezing, breathing with sensation of suffocation, nausea. Next one is Antium tart. Antium tart is one of my favorite in the cough remedies. Of course, wheezing and rattling of mucus, but little is expectorated after a great effort. Next one is Bryonia alb. Trickling of cough, worst at night, free expectoration in the morning, and worst in the warm room. First in the warm room, you can also think of veretum alb and Bryonia alba. Always Bryonia alba will be saying that something is there in my throat. Whatever I do, it's not coming out. Something is being stuck in my throat and it always irritates me. That's all. That is the peculiarity of the Bryonia alba. Ammonium carb. Chronic bronchitis in old and weak patients. Weakness is so much that he cannot rise up and he cannot spit out the mucus. That kind of weakness is there, but ammonium carb acts wonders in bronchitis, that to chronic bronchitis, that to weak old people with so much of weakness of the chest. Aconite nepalus, dry ropey cough, hoarse cough, constant pressure in the left chest, short and labored breathing with stitches in the chest. This is one of the peculiarity of the aconite nepalus. Antimonium iode. Antimonium iode is given in frequent the cough will be there, like like that, and the color is yellow and always thick mucus kind of thing will be there in antimonium iode. And if you ask for mother tincture form, mullein mother tincture, we give it 10 drops in half a cup of water or 100 ml of water. It is always for the removal of bronchial irritation. When the patient will be saying there is so much of irritation, I want something, doctor, external treatment, because nowadays everyone is used to that. So we says, okay, take this one in a warm water. You can just put 10 drops, and early morning when you wake up, you just kind of gargle with it. You can also add little bit of salt gargle also you can do, or you can also do with mullein mother tincture gargling also. This is one of this. And biochemical remedies I had already given Fermphos, and you can also give it in Fermphos only, I think so. For the cough, don't go for other remedies. Kali bike also you can give, but better give it in this potentized form. That's all. Everything you can give it in a tablet form only. Okay, this was my video about the bronchitis, which it may be acute or chronic, whether you should be really kind of concerned about or not. Okay, I'll be ending this video now. If you have any kind of suggestion for me from your side about your favorite or other disease which you are suffering, or your family member is suffering, and you want to know the treatment about it in homeopathy, please do comment on the comment section. Thank you so much. Please do like and share, and press on the bell icon so that whenever I put a new video you will be notified. Thank you.